My name is Keith Carson with Therapy Specialists. I'm joined again with my colleague Kelly Cooney, our VP of Compliance and Training. And we want to talk a little bit about the patient-driven payment model, but more specifically as it relates to therapy services. The 25% cap that they have put on both group and concurrent therapy. So it's a combined cap. So essentially, if that patient is receiving physical and occupational therapy services, then that patient cannot receive 25% more of group or concurrent therapy, which essentially means that 75% of the therapy they receive has to be individualized. Right. So I think people are kind of asking, as a therapy provider, as a rehab provider, and as a skilled nursing facility, what are the opportunities here with this new aspect of the patient-driven payment model?
Absolutely. Well, we're excited about the opportunity to have more different treatment modalities at our disposal. Mm-hmm. We love doing groups. We're very experienced with a managed care model, and in many of our managed care models, we have the opportunity to use group and concurrent a little bit more than we do with our Medicare patients currently. So we really are good at it, right? And we know which patients are going to really benefit and which patients might not. I think one of the things that providers may be a bit concerned about is the fact that there's kind of a number associated in this new model where it was really supposed to be patient-driven.
Yeah, I thought we were getting away from the numbers and the caps and all that
The fact that there's still these limitations on certain things is disappointing.
Sure.
Because there are patients out there that really benefit from the opportunity to be with other people during their therapy, right? I might have two total knee patients that are both of a similar age and really get along and really motivate each other and are going to do better if a lot of what I do with them is together.
Sure.
Other folks are not going to benefit so much from that. So what we need to be careful of as providers is that there's not a perception that everyone must get 25%, right?
Yeah,
but that many people are going to benefit tremendously from the opportunity to work with others. We're working with our software vendor as well.
Kasamba.
Yeah. They're doing some innovative things with helping us based on the impairments that we identify on our assessments to identify folks that might be appropriate to group together. So it helps the therapist make some clinical decision making. Doesn't say you must, but it gives them some assistance in determining whether this might be a good plan for that patient. So that's exciting to have a little bit more resources at our disposal for that.
Let me also ask, because now that there is this cap, which in the past we were not doing a lot of group and concurrent therapy for Medicare patients. You mentioned managed care, certainly different model. But I think there's a question about the impact that it's going to have financially, both on the facilities and on the rehab provider. What's that going to do to both costs and margins?
You know, I think there's a lot of opportunity for figuring out what's going to be the best contractual agreement for the facilities and their rehab providers. And that's definitely something that we're all looking at right now. How can we best do that so that this is a win-win for everyone involved? It definitely allows us more opportunity to get the same amount of patient care time done in maybe a little less time. So that's a good thing.
Improved efficiencies.
Exactly, absolutely, improved efficiencies. We need to still maintain those outcomes so that people maintain their star ratings, right? So that those Section GG items that are driving your quality continue to improve at the rate that they have been. So we can't back up the truck too much. We need to continue to provide great quality care and monitor those outcomes. It's going to be important that we make good clinical decisions based on the needs of the patient, patient-driven payment model. But as I said, we're really comfortable and excited about the opportunity to be able to utilize this modality a little bit more. Under the current system, and one of the things that we've asked CMS to take a look at, it's a little difficult to make a group happen. You have to have 4 patients to bring to the group. And that is pretty restrictive, especially, I think the data is that over half of the 15,000 skilled nursing facilities in the United States admit less than 8 residents under Medicare a month. And so if you have that few...
and a group is considered 4.
A group is considered 4. It's tough to get all those folks together. So we were looking and hopeful that there might be some changes in the definitions, but we do have the concurrent option available as well. So once again, we're excited about this opportunity. It's something that our staff is comfortable with, and we have a lot of resources at our disposal. So,
although this is in the final rule, my understanding is that CMS is still open to and flexible with that cap because they want to kind of see exactly what's going to happen and how this is going to change provider behavior.
Right.
While that 25% is there, they're still kind of accepting comments and they want to evaluate based off of the data whether or not they're going to make adjustments in the future.
Well, there's very minimal usage of these two options right now.
Yeah.
It's a very small percentage.
Yeah.
So an automatic jump from 0 to 25, I think they're concerned about that, that might have a negative patient outcome if providers are making the choices for the wrong reasons.
Sure. Yeah.
And so we just need to make sure that our medical record supports the care that we're providing and that we're clearly making the choices for the right reasons. So that if there's a data change for your facility that we can support it in the record, and that these new rules, we're following them, and that we're monitoring where we are towards that 25%, and that, once again, that we can support it in the record.
Yeah. Awesome. Thanks, Kelly. We have a number of other videos available on our YouTube channel. We encourage you to subscribe to that at therapyspecialistyoutube.com. And we will continue to keep you updated as it relates to what we're talking about as a therapy provider with regards to the patient-driven payment model. Thank you.
Thank you.